walkthrough of actually two states, but Washington's not here with us today. So it's all on New York, but I can't think of a better state to talk us through sustainability planning. Their efforts the last couple years have just been extraordinary. And we heard Dr. Caprio, who worked with New York,
Mm-hmm.
present at our International Research Summit. And so what we want to do today is just hear from New York about their sustainability planning. Tell us what's in the plan and why you included it. But also, if you could just talk about, as you talk about what you included it, let us know if you involved any particular people or used any particular materials to guide your thinking and planning. And also, I'm wondering if you're anticipating any particular threats to sustainability during the upcoming or during the grant period. So with that, just talk aloud and talk us through what you've done, and we'll listen and learn.
Well, Dina, I don't know, because I've been with this group for a long time. So they have, or we have provided all the sustainability planning documents that we've used over the last couple of years. So those are available.
Doris, let me clarify. What we had asked last week time was for a couple of states to be willing to let us know what the sustainability plan that they actually included in the most recent grant proposal.
Oh, okay.
Going forward.
Okay. Dina, do you want to talk about that?
If you all don't feel comfortable sharing that, please don't feel obligated to do that, Dina and Abby. You can pass.
Yeah, I guess I'm sorry. I was just trying to remember where we left off, because I think when not knowing what Doris had been sharing through this, collaborative, I was just chiming in on your behalf, Doris, with not being there. But I know, we do have a draft, and we were supposed to meet again this past August. Of course, that didn't happen. But we certainly can share what we have. We are using the toolkit that Arch provided in guiding our work. And I think the last time that we met in 2019, we really focused on our financing strategies and developed a draft logic model. So I'm not sure, Doris, was that something that you've already shared with them?
Yep.
Yeah, it is.
Okay.
And let me just interject. Not all the participants in today's call have been
there.
All the previous calls. So those of you who want information, I have all Doris's information that I can share. And if you could just kind of maybe talk a little bit about that process. It's maybe you are all used to it and it's like you don't think about it, but it's pretty, I think it's remarkable what you've done, and really exemplary in so many ways. And we can all, as a network, can learn a lot from you. So just talk aloud about your experience with that as well.
Well, as I had talked about before, the toolkit is massive and a little overwhelming. So if you're looking at that at the first time, but we were pretty intent on making sure that we had a trained facilitator to walk us through that, and he was able to condense a lot of that. So we did come up with the whole timeline and the sustainability plan, and really just taking a look at all those pieces. So if you wanted to look at it, if Susan were to share it and had any questions for any of us, Dina or Abby or myself, that would be great. I mean, I was talking to Dina today about, our workforce initiative, which started as part of our sustainability plan. And I don't know, I'm just going to brag a little for us, Dina, but we were awarded the Pacesetter Award from the SCAN Foundation in our support for family caregivers in New York this year. And so that was really exciting for us. And it has launched us into a few more projects. I don't know if you want to talk about that, Dina, or not, but it's really given us the opportunity to start to partner with organizations and higher level people throughout the state than we've been able to access before. So it's really exciting what we're about to embark on. So Dina, do you want to talk about that a little?
Yeah, sure, I can. It's really still very fresh, but because we were, New York was awarded the Pacesetter Award and have made such improvements when it comes to supporting family caregivers, that was the area in which we had improved upon that, provided us this wonderful recognition. I think because of the Director Olson's involvement now, and I think just, being presented this prize and this area of focus on supporting family caregivers, it provided us an opportunity, I think, in really identifying kind of all these different strategies, right, that we've been working on, and thinking about how we might be able to partner more formally with some of the folks at the state level that we've been trying to. So to Doris's point, probably you guys know that CHCS, they've been working on this learning collaborative where they're embarking now on their second phase, but the first phase was with 6 states from 2018 to 2020. So they kind of highlighted that there was this opportunity to join for phase 2. So we did put a letter of intent in, and we're planning to apply to be part of this learning collaborative. And I think our application is due December 7th. But what I talked to Doris about was, instead of us working, on the workforce, what we're doing there with supporting caregivers in the workplace and some of the strategies that the coalition has been pursuing, we've been doing things too out of the state office, which I know I've shared about our guide for businesses. So we kind of put our heads together and said, as we're completing this application, it just seems to make sense that we have this really be our focus. And so that's what we're planning to do. So we're thinking that will formalize our partnerships with the organizations and government agencies that we think need to be part of our project team. And it will, I think, really help when you're thinking about it from a sustainability standpoint. So
That's
we
fantastic.
can certainly keep you
Go
posted on how things move forward with that and whether we're selected.
So Dina, I'm going to just interject a little teaching moment. I went back today and looked at on the ARCH website. We have a summary of all that we learned from the initial project, the initial sustainability projects using the toolkit, with the goal of sustaining coordinated systems as the law prescribes. And so the first most important thing, or where you start, is with partnerships, diverse partnerships, shared leadership, and including those formalized partnerships. So I just want to point out that those come from the planning process, but they also are essential to sustainability. So if you could just find a model of what you wanted to do in terms of partnership and shared leadership, mentoring, protecting historical knowledge and writing. New York has done all that, and all those little pieces. So we're looking at their achievements, but those achievements came about because of all this work that we don't see, and that's the kind of that's the hard hard part that gets you to the achievement. I want to think what else you said that really stood out for me as something exemplary. Well, you were talking about, you talked about the coalition pursuing strategies and the state, putting our heads together, and that again is it's so laudatory, and the willingness to do that. And it really reduces the threat of leadership change that can happen. Like if one leader, we've seen in some projects where the state coalition relies on one leader and that leader's replaced when the governor's replaced and everything falls apart. And would you just talk a little bit about that, New Yorkers, about how, any threats that you see and how the structure that you've built could help you weather those threats?
George,
Do you have
wanna
any
take that,
thoughts
or you
on-
want me to?
Well, I can give it a shot. I'm feeling so excited about all the work that we have ahead that I'm not focusing on threats. I'm not sure, really the biggest threat right now is just looming above us, and that's, COVID and the challenges that especially all the volunteer programs, all the, social adult day programs, all of those are struggling with creative ways to meet the challenges. But, there is a vaccine on the horizon, and boy, I just hope that we can, do our sustainability summit next spring, and that we're able to continue our sustainability work committee, which will probably be bigger. I don't know, but with the partners that we've targeted to involve, I mean, maybe a threat would be that they don't want to participate, but I can't see that. Really, there's always, it's crazy, but we have an advisory board, and I had said to the advisory board that I was frustrated with not being able to reach out to CEOs and presidents of organizations who could do the whole survey thing, and we could start to engage at that level. And one of them suggested that I reach out to Director Olson. So I did. And then it just snowballed. He sent me this thing that he's been working with the two major insurance companies, and they were all on board for really talking about caregivers in the workplace. And then we had a meeting, and we have an outline, and we have partnerships that we're going to pursue, and all. It's just snowballed, wouldn't you say, Dina? So, I mean, maybe the threat is, I don't know, our own enthusiasm, but I'm just so excited about what we can accomplish here. And go ahead, Dina.
Yeah, no, I think too, when it comes to like just being concerned about, any threats, and I do hear what you're saying, because of course, whenever we've seen it right now with our our Department of Health at the state level, there's been many retirements. And so we've, even through the work of developing the guide for businesses, they were part of our work group, and they kind of fell off. And so I do get concerned about that, but I will say that one of my suggestions as part of applying for this learning collaborative is that they're only requiring a letter of support from our director at the State Office for Aging. But I had recommended to our director that when he invites, the organizations or representatives that he wants as part of the project team, or that we're, also recommending, that we get letters of support from them, or a letter of commitment or something. Because I think we really do still need to make sure that they understand what the ask is, and that they're committed to the work, because we're kind of taking this lead role. But I do hear what you're saying, because in order for it to, be sustainable and achievable, where we can get what we're setting ourselves out to do, we get it done, we need to make sure that they're going to stay on board for the duration. And it is a 2-year project.
Yeah, so that's so good, because that was something that undermined some of the projects, that they didn't have it in writing, that the partners didn't have a clear understanding what the commitment was. So that's fantastic.
I would share too that I know, just from Director Olson's standpoint, what really helps us here in New York State is, I think, with the governor having other policy, right, and executive orders that tie to like health across all policies, so a lot of this work ties to that, which gets that buy-in, that commitment from that higher level. So I think that that's always helpful when you can kind of tie the work to what the governor's directive is to all agencies, right? So that's always helpful too, I think.
Okay. So tell us a little bit more about that. So the governor's policies and executive orders, they pertain to respite, but they don't directly mention respite. Is that?
Right. So there's a lot of things you can
Caregiver.
really tie to like health across all policies, right? But you're thinking about it from the older adult, from the, from anybody who lives within New York State, from all residents. So it's kind of nice that it is like that large umbrella, but you can kind of tie all this work where you're really showing, the age-friendly communities, the, aging in place. It's just, I think that's and Greg could speak so much better to it. And we do have some information I can share about it, but I do think that that has been helpful too, just in any of these things we pursue where you can kind of see the tie to that. So
Yeah.
that's been helping us with the work.
I think that sounds really important. So I think more information would be great. Like, I mean, how does that happen? Who takes responsibility for kind of knowing and for knowing what's out there from the government, and who figures out how to make the links in both in relationships and how the policy is relevant? Do you do you have just somebody that is designated to do that, or how did it happen that you're so smart?
No, it's just agency director is really responsible. So the executive order is really to the agencies, right? And making sure that they are following this order. So, and anything I think that we do out of the state office for aging, and trust me, we're small in comparison to all the other state agencies. I think we're down to about 90 staff. But, Greg is so good about, just tying all of our work and having it framed in a way that fits with what we're directed to do by the governor. So I think that just helps, right, in just making sure that we have that level of support from that, at the top. Right, because then it trickles down, and I think that it provides us that ability to get the partnerships that we seek, because we can frame it that way. But I'm happy to share. I can certainly share, just so that everyone can get a better understanding of of what Health Across All Policies is all about. I'm sure many of you are familiar with the age friendly, but I know that for me, it was helpful to kind of read about a lot of that because it's not really in my wheelhouse. Of course, I see the connection, but I don't deal with it day to day, and Greg did a little bit of explaining. I don't know if it was highlighted in our interview for the Pacesetter Award, but definitely it's in the fact sheet for New York State. So we can share the link to that as well, but I'll share some information. I made note of it.
So this is really getting to be a theme too, because Massachusetts, I don't know if Leanne's on yet, but Amy's on.
I am here, Susan. Yep. And Amy is on as well. Yep.
Is this getting you thinking about what you're doing? I mean, I thought immediately of you, and I thought of Oklahoma too. States where you have this kind of really high level knowledge and understanding of what other agencies and programs are doing and how it's relevant to your work, and then from that awareness, real planning and activity. Do you want to jump in on that?
Yeah, so I'm listening. I appreciate New York sharing everything. I actually pulled up your site too while you were talking. But my question, when I think about Massachusetts, it's, it varies across the different state agencies what they're doing. Certainly our Executive Office of Elder Affairs has a big focus with their Alzheimer Advisory Council, pulling in the caregiver. When we look at agencies that serve younger populations, I see that's where we have a disconnect. So I'd be very interested as far as any policies that are happening at the state level to ensure that it's caregivers across all populations. And so, and that's sort of where my mind is there's a lot of emphasis on older populations and Alzheimer's and dementia, rightfully so. It's a very large population. But when I'm working with my state partners here in Massachusetts, it keeps coming up that when we're looking at children and youth with special healthcare needs, children within the foster system, children being, with intellectual developmental disabilities, to ensure that they're receiving support, the family caregivers are receiving support. So I don't know if New York knows a little bit about that or any others. How do they ensure continuity across all programs? Amy, do you have anything that you would want to add on to that, or do you see it's the same?
Amy, I think you need to unmute.
Yeah, you're muted, Amy.
Are you in there?
Can you hear me now, or am I still muted?
Now we can hear you
You're
and
good.
see you too.
Okay. Well, that's so weird. Yeah, no, I really agree with what you said, Leanne. I think you've been much more involved than I in the last few years, but I think that was always a challenge, just getting particularly the child serving and the elder serving agencies to kind of align around commonalities. Yeah, definitely.
This is Nadine
Well,
from
I think
Oklahoma.
Oh, hi, Nadine.
Sorry.
Hey, hi. Sorry, I'm having some computer issues, so I'm on my phone, but it's good to see you guys. I got on late too, so I missed part of this, but it is a struggle to get the leadership to understand that, we're lifespan. And I go back to this all the time, and I can't preach it enough, I guess, but our coalition, I mean, these partners coming together that are serving individuals across the lifespan is what's made the difference in Oklahoma. Now, when they hear family caregiver, they don't think of just the younger population or the older population. They think of them all. And so I think it's a matter of getting your partners educated and working together is what's made a difference here. And they're realizing the more we get out and the more we talk and the more, conferences that we have that are caregivers across the lifespan, and we just keep preaching it. That's how you make the difference, or that's how we have in Oklahoma.
Well, I'll just say I think it's a frustration for all the coalitions to bring in all the partners in the disability realm. We have pretty good connections in the OPWDD world. We in year 2 of our grant, we're focusing on kinship caregivers. So I'm doing some pretty significant outreach to all the kinship programs in the state, so that we're recognizing caregivers in the kinship world are not only grandparents, but nieces, nephews, brothers and sisters. And so we're kind of excited about the kinship piece as well. But I think you're right, Nadine. You got to be out there and preaching it all the time. My whole mantra is caregivers are everywhere, and it's just not our older adults.
And is that Doris speaking?
Yes,
Yeah, and Doris, you're with New York?
yes.
Okay, thanks.
I'm the director of the coalition, and Dina's with the New York State Office for Aging.
Oh, okay.
And she turned on her camera.
I
I'm
did.
very proud of you, Dina. So everyone, that's Dina.
Hi.
I think for Massachusetts, just to follow up on what you guys are all saying, I think a big game changer for us really is that Leanne's been able to make a really strong connection with some high level folks at DPH who work with children with special healthcare needs. So I think we're in a really great place to advance that connection and having that buy-in. Someone else was talking about this earlier, but having that buy-in from our Department of Public Health that manages the Title V programs has really been significant. So yeah, absolutely.
So talk about what you all are looking for in those partnerships. Is it like written policy? Is it diversity of funding? Or, in real concrete terms, what do those partnerships mean?
Across the state agencies, it would, to shape policy and to increase funding services. And what we've been able to learn, I think we've all been experiencing, is that there seems to be a disconnect or not a big enough focus on the family caregiver. So much of the state services go into the care recipient, and how do we extract that out and raise awareness of the needs of the family caregiver across the board. And so I am excited because we've seen some shifting where there is working with the different state partners and bringing caregivers to the forefront. A couple of the state agencies with the next budget requests are requesting additional funds for family caregivers. And so that's been really exciting. Well, hopefully seeing these tough times, but just getting it to that level is huge. So
That is huge.
yeah, definitely looking at policy changes and in sort of shifting of budgets, right?
Bless you.
Yeah.
Thank you.
Thinking back to what you all have said and what. So let's take this back to when you submit a proposal to ACL and include in it a sustainability plan, which is now required. What goals and objectives do you include in the grant? What advice do you have for upcoming grant applicants, and what are the strengths of what you've included in grant proposals in terms of sustainability?
Dina, are you pulling up the grant proposal?
Yes, now that I have two computers open, I'm
I knew that. I
multitasking.
knew that. Dina was the author of this grant, so I'm going to leave that to her.
And whatever you wrote, Dina, it worked, right?
Yeah, it did. I had help, trust me. Had Abby, Jen Rosenbaum, we did it as a team, and Doris, of course, helped with input too. But I guess why I'm looking, one thing I'll share, and just something we're in the midst of doing right now that I thought was important when thinking about sustainability. So under our National Family Caregiver Support Program, which I also oversee, we are looking to expand our caregiver directed model, because right now what we've been allowing our AAA network to do with their Title III funds is offer in-home respite with using a fiscal intermediary and allowing for PC1, PC2 level care. And we want to expand that. We always intended to do so. So we're launching a work group in January. And one of the things we put in our lifespan respite application was we're trying once again, I guess many years ago, we went down this road, and it was before I was involved, but we were unsuccessful with launching a voucher model. So we have that planned for year 2 and 3 of this grant, with the first year of being really the development phase. So my thinking is that we made the decision to focus on kinship caregivers, because we know that through the various kinship programs across the state, many of them do not offer respite. So there's a real need there. And so we, in our application, said that we were going to have that be our target, would be the kinship programs for year 2 and 3. Well, my thinking is that when and if these funds dry up for offering vouchers, where are those kinship programs going to go, right, for those continued funding? They're going to look to tap into the 3E dollars, right, and go knocking on their area agency on aging's door. So Doris is actually going to take part in the work group that we're launching that will include, I couldn't believe we were just reviewing the survey. We have a number of AAAs. I think Doris, you're going to be shocked by this because you didn't even hear this. I just found this out. 47 people want to be involved with the work group from across the state. So,
oh my gosh.
Yeah, we were kind of like blown away by that. So we were talking through our plans for that. But my point is that I think when we're talking and thinking about sustainability, that, you know, when we go to develop this model, we need to be mindful that it's going to be a model that works under both funding streams, right? So that's why we figured it just made perfect sense to have, you know, Doris be part of our work group from the coalition, so that when we design it, we're thinking through, you know, both programs and making sure it's going to work.
Brilliant. That's great. So you're really strategic and inclusive.
We try.
Yeah.
So can I just ask a follow-up question on that, Dina?
Yes.
And so you said you are focusing on the kinship. So when you submitted your sustainability plan, you emphasized the kinship program, and you're looking to revamp the voucher program? Is that what you said?
We never were successful with launching our voucher program. So right now in New York, we don't have vouchers.
Right.
And with this last round of funding, there was such a strong emphasis on direct respite delivery, which we really have primarily focused on just our pool of volunteers that Doris has really taken lead on, the REST model.
Yep.
So we wanted to make sure, of course, with it being so competitive, that we were including other ways of delivering respite care. So we're venturing for the, I guess, down this path once again. I'm not exactly sure what happened. It was before
Yeah.
Doris and I were involved before.
Yeah, in Massachusetts, we don't have the voucher model either. So we're within the state, we have large number of funds are offered through stipends. And so we're looking, I think, similar to what you're saying. So I'm very interested. Yeah, very interested in that. So maybe I'll reach out to you afterwards.
When you say voucher, what do you mean by, how are you guys going to work the voucher program? Because the state doesn't have it, but my program does, Helping Hands of Vegas Valley, and I use it. That's the only way I do mine. So I was just curious what you mean by how you were going to work your voucher program, or see it working.
Right. So we don't know. We're developing it. And then we know that there's many different models, right? So I think that when we're looking at it from offering caregiver directed respite care, that we want to make sure that we're not limiting in any way when it comes to our 3E program. Of course, for lifespan respite, we were very specific in saying it would be through use of vouchers, but that we needed that first year to develop the program. So our thinking is that whatever we land on for lifespan respite, we want to make sure that it's going to also work under the Title III funds, so that could be an additional option for our AAAs as one of the National Family Caregiver Support Program respite care options. Our thinking is, because like I said, the only option we offer right now, and we have 17 of our 59 AAAs that have requested and been approved to offer consumer directed, caregiver directed, I prefer to call it, but they like to call it consumer directed. And they've really, the way that we've implemented that is we used our existing model under our state program, expanded in-home services for the elderly program, because we had state regulations, all the work had kind of been done in how they could operate that model. So we allowed them to do that for now, with the understanding that we were going to go back to the drawing board and expand in looking at other models that could be offered. It is not saying that we're going to require that the AAAs offer whatever we come up with, but I think what this work group is intending to do is to explore the various models that exist, figure out which ones seem like that they would work, and then if we do allow them to, they can choose to offer it. They would still have to go through an approval process where we would make sure that it aligns with whatever guidelines that we set or policy that we set regarding it. So and I know we actually have a new staff person that started, I don't know, I think in April. So we've only seen her a few times in the office because of our schedule right now. But one of the reasons we weren't able to kind of focus on this work before is just my bandwidth. I didn't have it. So she's now taking lead on the work group launching in the new year. And so we're really excited. She's doing an excellent job. So we surveyed, we just got the survey results back. And now she's putting together a game plan. And actually one of the other resources that we're using was Arch had put out, Abby helped me with the name of it, but we were just talking about it on our call. She might be muted. Do you remember the name?
Sorry, I'm trying to unmute and now, okay, I finally just got it, but I'm blanking on the name too.
But it had something to do with developing a respite, consumer directed
Voucher model.
That pretty big resource that Arch, I think, developed a number of years ago. I want to say it was from 2011 or something like that. And Jill.
Oh, yeah. We worked with what also no longer, well, it's renamed Applied Self-Direction as a group, but it was the National Resource Center.
Okay.
Participant directed
Yeah.
care.
Yep.
And
Yeah.
they did a guidebook early on different voucher models and procedures to follow with some case studies.
Can I ask a question with the, can I ask a question with the voucher models for those that are using them? How do you report back wages for individuals that are being paid through the voucher? Do you do W-2s or anything like that? I'm seeing that as an issue because when I think about our personal care program, this would be an ideal audience for potential respite. That is something like, how would we be able to be sure that through that, the wages that they're receiving through the vouchers, I guess, taxes?
This is Corey. Leanne, I don't allow independent contractors. So we don't allow to have anybody, them just choose a person. They have to use an agency and the agency bills us directly. That's the way we've done it. But for the rural areas, I am looking to try and expand that some because obviously agencies aren't out in the rural. So I'm trying
Yep.
to do that because we had that issue before when we did allow independent contractors. And
Yeah,
we were having to do 1099s for them. And then we kept getting state things of, can you tell us why this person does or does not qualify for workman's comp, unemployment and stuff. And we're like,
Oh,
they were never employed with us. They were, an independent contractor.
yeah.
So yeah,
Interesting.
we're having to work about that too. And then of course, if you do, like my vouchers are worth $1,000, well, that means I have to report it to the IRS and that creates an issue. So we're looking to maybe do smaller amounts, but it can still create issues. That's what we're looking in. And of course, we have to protect the state since the funds come from the state. So I have to look at it all around. But the only way for me to reach the rules is to do independent contractors. So it's something that I'm really, really looking at and working with, like the Alzheimer's Association and stuff like that.
Yeah, okay. Yeah, that's helpful. Thanks.
yeah, that's really interesting, Corey. And I, maybe we could schedule a meeting off separately to just kind of talk about those challenges. What I'm hearing from the kinship directors is that they don't feel like they would welcome agency staff into their home, and they're much more, they'd be much more comfortable in hiring friends and family because these kids are already traumatized in many cases, and they just don't feel comfortable bringing agency staff in. So that's a really interesting piece for me. But those logistics on the unemployment and having to provide 1099s and all that stuff, that's something I'd like to hear about.
This is
Jill. We've covered a lot of these issues over the years. And now we're talking about them regularly in our voucher learning collaborative. So if you're not part of that group, in terms of implementing your voucher programs, I would welcome you to join that. We also have, Montana's been doing consumer directed vouchers for a very long time. Nadine in Oklahoma, I'm sure they have more immediate expertise. If they're willing to share that right now, that would be great.
Hey, this is Nadine. I think Amber has already reached out to us and we're setting up an appointment to visit with her about our voucher program. And I think we've got it down pretty well here in Oklahoma. So we're anxious to visit with you about it.
Yeah, we're looking forward to that. Thank you.
Well, I have to go. I'm really sorry to have to go, but I have to take off to teach.
We're glad you could
So-
join us for most of the
Have a
meeting.
safe
Nice
holiday.
to see you all.
Thank
Thank you. Bye.
So Montana, do you have anything to say to share about vouchers that could be helpful?
Well, I had a question. There was somebody said that they were going to go from a stipend to a voucher. So I had a question of what is the difference between a stipend and a voucher? And then I was just going to add, we set our limit of $600, and I think that that's the taxable break. And we're giving the voucher to the caregiver to then employ whoever they want to. And then we're asking that, just like a babysitter or whatever, that they then apply for their own taxes if they need to report that income on their own taxes if they need to. And that's kind of how we worked it out. we do look at, you know, if we were to increase our voucher rate, you know, right now it's set at the $600, but sometimes people's needs are higher than that. And so I think that puts us kind of in a different position where the amount of the voucher is higher and would be considered taxable. But again, we don't know if that caregiver then is paying 4 different people or one person gets all the voucher dollars. And so we're kind of trying to work out the details and make sure that we're doing that correctly and make sure that our responsibilities are covered. But, you know, in some ways we're shifting that responsibility onto the caregiver because they become the person who employs the respite provider.
So this this makes me wonder about one of the things we've identified as most important in sustainability planning is including performance measures in your planning. And Brooke, as I'm hearing you talk, it's like, so it sounds like you're like trying to figure that out by getting more information from the people that are using the $600. Are you using stipends or vouchers? Is it called a stipend in Montana?
We call them vouchers. And
Vouchers,
my
okay.
question was, is there a difference between stipend and vouchers? That was one of my questions.
Yeah, I can't answer that. I don't know if other people define it differently. Jill,
I think a lot of it is semantics, but it does depend on who's receiving the funds, if it's the family caregiver or the respite provider, and whether it's provided in advance of the respite or following the respite. And I think states just have preferences for the wording that they use. Some states call them grants. Grants, stipends, vouchers. And people may have their own definitions for each.
So let's talk a little bit about performance measurement for your sustainability planning. So when I say performance measurement, I'm talking about gathering information to guide you in decision making, like knowing how people are using their voucher money and what the issues are. Performance measure for quality assurance to make sure you're doing what you're saying you're doing, and for accountability, and also for advocacy, so that you can show that your work's making a difference. Tell me your thinking about that, and who's maybe included some performance measures in their grant proposals, or are thinking about what to include in a grant proposal in terms of sustainability. Anybody had any epiphanies while in terms of performance measure?
This is Nadine in Oklahoma. The pre and post surveys, I just can't say enough about those. I mean, that has always been a go-to just to determine where we're at, what our success is, reaching the caregivers, how the voucher system's working. And we take those to heart, and we have over the last 9 years. And, you know, it has allowed us to have some flexibility because of the respite grant. We have that flexibility to make those changes, which is a blessing. And I think it's just really guided us over the years through the voucher program in how to make it stronger and better, and to coordinate with, we have 9 respite voucher programs in Oklahoma. And so you know, we're all coordinating now. Everybody knows each other's program. The referral system's great. So I think that, and, you know, the application, when people apply, there's a lot of data you can get off of those applications to use. We use that. We use, you know, anytime we have a conference or a presentation, we have a an evaluation after the event. That's data that you go to the legislators with. That's the data, the performance measures for us that we use. And I was on the developing that performance measures document that ACL was using. I haven't heard much about it this year, but prior to, I just forgot her name, that left, she was really pushing that. And it's a great tool that we still use that's helpful. So Those are just some of the things Oklahoma uses to evaluate and measure our performances.
So I'm going to ask you questions in a sec, but I wanted to let everybody know there's a performance measurement work group. If you don't know about it, the next meeting is December 10th. It's at 2:30 Eastern time. So if you're interested in that, let Jill or I know, and we'll make sure that you're connected with that. It's going to be a really good group, and it does carry on some of the work, Nadine, that you were just mentioning, that was started with ACL. So Nadine, I wanted to ask you, you talked about, oh shoot, now where did I just write this down? Oh, you talked about, oh, the application process, the pre-post survey. Do you use something that you feel is like really reliable and giving you great data? And is it something you developed, or is it something that you found? And then also I'm interested in what kinds of data you get from the application process.
You asked a lot of questions.
I know. You do a lot of good work. I can't help it.
The pre and post, that was with Jill's help and Arch, and over the years we've tweaked it, and again we're tweaking it and fine tuning it. We're trying to get all the respite voucher programs to use the same application. So what works in Oklahoma probably wouldn't work in other states, but again, that's just been trial and error over the years to see what's good. And you don't want a real long pre and post survey.
Right.
You want to keep it short and simple and get the most out of your, bang for your buck. So that, and then the application, I mean, you find out who's applying as far as the caregiver and the care recipient, what their ADLs or IDLs are, their sex, their race, their all that, just to see who we're serving and that population. And I don't remember the other questions you asked me.
I think you've done it. I was wondering where the pre and post survey was, where it came from. Is that something that other people could use or borrow from?
Of course. Like I said, I don't know, because of the way we've had to tweak it over the years to include the other respite programs. I mean, it's obviously there to use and to be looked at, and we're actually in the middle of redoing it again. But yeah, once we get it done, I'm happy to share it. You may just be able to take a few questions out of it.
And you said you have 9 voucher programs. So do they all use it? And if they do, how did you orchestrate that?
The coalition just coming together, and over the years coming together and saying, we really need to serve our caregivers most efficient and effective ways. We need to all be talking the same language. And so again, back to the coalition, and you guys get sick and tired of hearing me talk about the coalition, but that's what did it. It's just bringing them together, having a subgroup on the coalition of respite providers, getting to know each other and seeing the need. And it's a win-win for the caregiver and for the provider, so that they know if they can't serve them, which program can.
Great. Corey, I'm just going to pick on you because you're so strong on data collection. Do you have anything you can think of to talk about in terms of performance measurement that would be helpful for sustainability?
Were you asking me, Susan? I'm sorry.
I wasn't asking you.
Okay, I can talk for just a minute, and then I have to go because it's our annual meeting in just 5 minutes. So I do the same thing. I do a pre and a post survey, and I have been since I've been in charge of the respite program at Helping Hands. I was interested in the fact that Nadine organizes the entire state and sees it from that perspective. With mine, what I did is I looked at the Arch website, and I looked at all the different pre and post surveys that were there, and I pulled a bunch of them, and I looked at what the state was asking, some of their pre and post questions, and then I sort of pick and chose from all of that, and then I had to get it approved by my resource development specialist, and she said yes on it, and so I have those. And so, when I send out the initial application, of course, that's when we do the pre-survey, and then the post is when they're done with their voucher or close to being done. and
Uh-huh.
then we get into a database and we do it that way. And that way, when I get audited by the state annually, they have all access to all of them electronically and in paper form. So we're sort of old school in the fact that we keep both. But with me being in Texas now, I have to have a stronger electronic presence,
Uh-huh.
which is good paper wise. So we're working on that, and it makes it where we can see it a little bit better. So,
Thank you. That-
but I'm really interested. Nadine, I have a question for you. You said you are doing it throughout the entire state. So all of the agencies that provide respite vouchers, like the Alzheimer's Association and all those, they all use the same questionnaire or surveys?
We're getting there. We're getting there.
That's awesome. That way like you said, you're all speaking the same language. I would be interested in seeing how you're doing that and how you got that to be organized. So I will pick your brain another time, but at this time I have to say goodbye to everybody. See you
Okay,
guys
call
next time.
anytime.
Have
So
a
glad
great
you joined
Thanksgiving.
today.
Bye.
And actually, it's just time for all of us to wrap up. I'm so stimulated by today's conversation, and I heard so many mentions of different resources. I'm going to try and pull all those together and just get a list to all of you about all the things that we talked about, the available meetings, the voucher meeting, the performance measure meeting, the documents that people have found useful. And we can maybe just start adding to those as we go.
Yeah.
Is there any parting words of wisdom before we say goodbye until January of 2021? So glad to be rid of 2020. I can't wait.
Yeah, can't wait. Yeah. No, I just look forward to getting the list of resources from you. I think that's
Okay, I'm looking forward to pulling it together.
great.
Carrie, so nice to see a new face. I'm really glad you could join us.
Thank you. This was really good.
Yeah, these
I
girls are
took
smart.
I've got notes, I've got names.
This is a smart and productive group.
Yeah, I'm impressed.
Passionate. We're very passionate.
Yep.
Yeah, and really supportive of one another.
That's
So,
That's good.
so I want to thank all of you for this time that you've invested in one another, and wish you the best, safest, happiest of holidays.
Great. Thank you. Same to you.
Same
And
to
we'll
you.
all gather in January.
All right. Great. Bye-bye, everyone.
Take
Bye-bye.
care, everyone.
Bye.